Well, it is 6 o'clock, so it's time to start our webinar. Thank you everybody for joining SBA's SBU webinar on becoming a parent with spina bifida. Today, we are going to be covering, these are the points we're going to be covering today on becoming a parent. First of all, first and foremost, is that it's absolutely possible. And so we're going to review some facts about conception and parenting, discussing about just making that decision to get pregnant, some health considerations during pregnancy, what life is like with your baby or toddler. And then we're also going to have an open question and answer session. Please remember that you are able to submit your questions during the presentation itself by chat, and we'll be getting to them. These are our speakers. We're really thrilled to present our speakers today, and I'm going to let them introduce themselves. Courtney, would you like to start?
Sure. My name is Courtney Struer, and I am a pediatric urologist at the University of Michigan. And then I also do research about half the time. Then my research is focused on the sexual and reproductive health of women with spina bifida.
Great, thank you, Courtney. And Linda, please tell us about yourself.
Sure, I'm Linda Longo-Leal, and I'm on the faculty at University of Massachusetts Medical School, and I do some teaching in our LEND program, Leadership Education and Neurodevelopmental Disability, and I also do research as part of my role at Commonwealth Medicine, which is the consulting division of the medical school, and a lot of my research is on reproductive health of women with physical disabilities.
And you also have someone in your picture?
Oh yes, I have my son Ben. I'm a mom with spina bifida, and that is my son Ben when he was about 2 years old.
Excellent. And I'm Juanita Panliner. I'm with the National Resource Center of the Spina Bifida Association, and I'm also joined by Judy Thibodeau, our Director of Research and Services.
Thanks, Juanita.
All right, so here you go. Here's a little reminder, just you can use your chat function, use the chat to send your questions. So Courtney, would you like to get us started with this question, if it's possible to have children when you have spina bifida?
Yes. All right. So men and women with spina bifida can have children and become parents. We know that women with spina bifida have pretty much normal fertility. We don't know, spina bifida doesn't impact fertility or ovarian function or anything like that at all. So it's completely normal. Less is known though about men. There's a lot of men with spina bifida who have who become parents. They have children, no issue with it. There are some men though who may have a low sperm count, and may have some issues conceiving. And there's also some men who may have difficulty with ejaculation, and what that means is getting the sperm out. So I would say if you are a man and you're interested in having a child and curious if that's possible, I would talk to your urologist and just let them know you're interested, and they will ask you questions about your ability to ejaculate. If you're not able to, there's other methods of extracting the sperm. And then they can also do some tests on your sperm that we do on lots of men who are interested in fertility, just to see what may happen.
Thank you, Courtney. And on that point, just as a side note, that is the subject of a webinar that we're also hoping to put together in the coming months. So stay tuned for that.
Thanks. So my recommendations for you, if you are interested in becoming pregnant, and this is going for women, obviously, because they will be the ones becoming pregnant. But to start off, I would recommend finding an OB-GYN. So an OB-GYN who generally we would recommend seeing a high-risk OB-GYN, and I think you should probably see one at least once. But the most important thing is that you find one that you like and who you feel like is supportive of you and your goals. So obviously that goes with any provider that you find, whatever it is, that you need to find one that you like. But there's different providers who have different levels of comfort and understanding. And so I would just say find one that you like. it's important to see them before you start trying to get pregnant, if at all possible, because they need to do things like review the medicines you're on. There's certain medicines that some women may be taking that are not safe during pregnancy, that could cause some problems for the babies. Those include like seizure medicines. A lot of seizure medicines are not safe during pregnancy. So they will review all those medicines with you, and you know, they may send you to your neurologist or other doctors to kind of come up with a plan. I would say you should let all of your other specialists and other doctors know as well, so they can help you kind of plan as well. So for example, as a urologist, if you have frequent urine infections, I may put you on an antibiotic or something like that. So just let all of your providers know. The other thing that an OBGYN or any other provider would do is that they would prescribe a high dose of folic acid, which we generally recommend starting 3 months before becoming pregnant. This is a much higher dose than for a woman without spina bifida. So it's a much higher dose than you would take in like a typical prenatal vitamin. And so this is something that you can be prescribed. The reason to take this is to decrease the risk of neural tube defects in the baby. And just to be clear, obviously it's not, I mean, we love everyone with spina bifida, and we're not trying to necessarily prevent spina bifida, but there's certain neural tube defects that are not compatible with life, meaning that there'd be a high risk of having a miscarriage. And so this would be to help prevent miscarriage. Go to the next one. So things to keep in mind during pregnancy is that you could have a lot of changes in your bladder and bowel function. So there's a lot of women, honestly, whether or not you have spina bifida, who may develop some incontinence during pregnancy. And then there's who may have difficulty catheterizing. So there may be some difficulty even reaching if you catheterize in your urethra. If you have a bladder channel, that baby may start pressing against that bladder channel to make catheterizing difficult. And so you'll have to work with your urologist to come up with alternate plans. And then constipation is very common during pregnancy. The hormones that you release in pregnancy just slow down your bowel. And so you may need to change your bowel program. There's an increased risk of urine infections during pregnancy. And so that's something that we want to watch closely, because that can cause some problems with pregnancy. And so that's where you want to work with your urologist, and they may put you on a low dose antibiotic every day, a prophylactic antibiotic, and test your urine more frequently. Again, working to prevent constipation can also help decrease your risk of UTIs. Linda, you can take this one.
All right, so physical changes during and after pregnancy. A lot of women want to know, was it worth the permanent changes to your body? And I think that this is a question actually that all women confront, because I think no woman's body is exactly the same after she's had a baby. You gain weight and you have other physical changes, and those of us with spina bifida are no different. I know for me, my belly stretched out a lot more, and it stayed that way to some extent. Gained weight, haven't never taken it off. So those are things that were challenges. I personally did not have lower back pain, but I know some women might. Did women who may also experience worsening bladder and bowel leakage? You have an ostomy. I'm probably a lot older than a lot of women now having babies, and when a little kid, this is what they gave you, a urostomy. That is, they rerouted your bladder, they rerouted your urinary system so that the urine goes straight from your kidneys out through your abdomen via a stoma. So I have one of those, and it didn't really, I was able to make it so it didn't leak a whole lot during pregnancy. Afterwards, though, because of my expanded, stretched out belly, I had to change the bag that I use. I had to change how how it fits. I had to modify some things, but I made it work. And so now it works pretty well. Will I have prolapse? You very well might. In fact, and I'm going to ask Dr. Strohr to chime in here. Some of us with spina bifida may have prolapse to begin with, but we may not know it. I certainly had no idea that I might have a prolapse. And after I had my son, about 4 years later, I did have a prolapse that I really couldn't ignore because it was pretty bad. And I just woke up one morning and there it was. So, so yes, you could have a prolapse, and that can also affect your continence, your urinary continence, and your bowel continence, I believe, going forward. So that is something you should definitely talk with your doctor about and be aware of as a risk. Dr. Strohr, do you want to comment on that?
Sure. I'll just add, all women have permanent changes to our bodies after having a baby, but I think most of us would say it's worthwhile, although it may depend on if they're a teenager at the time, what your opinion is on that.
Right.
So in terms of the bladder and bowel leakage, yes, you could have worsening leakage both during pregnancy as well as after pregnancy. And some of your regimens may need to be changed. And then prolapse. So this is kind of an area of new understanding, but we essentially think many women with spina bifida have prolapse that may not get diagnosed. We typically don't do anything about it unless it causes issues. The prolapse, we think, is just because the pelvic floor tends to be weak. And so yeah, so you don't have to do anything unless there are issues. So issues that could have, like you were talking about, would be worsening incontinence, or having some bowel leakage, or you could also have some pain with sex. So having a baby, basically, so all women probably have some degree of prolapse, and having a baby will not help. We don't know if having a C-section decreases the risk of having significant prolapse. It does for in general in women, and so probably is that enough reason to have a C-section? We don't really know, but yes, I would say it is common. Oh, and someone is asking what prolapse is, which is a great question. So prolapse is when essentially the walls of that support the vagina are weak, and so the bladder or the part of the bowel may kind of protrude out of the vagina, and it can be so bad that the vagina kind of everts. So it's basically, people talk about having a bulge or their bladder falling in, or some women after having a baby will talk about a bladder tack. That's all related to prolapse. So I hope that makes sense.
And in case you're not able to see it, we also have a question, which is, can pelvic prolapse and weakness cause issues with the ability to carry a pregnancy to term?
That is a great question. It shouldn't. We don't think so. That is something to talk about with your OBGYN, but it shouldn't.
And something else I should add here, not on the issue of bladders, but as you can see, I'm walking there with crutches. That's me. I'm walking with crutches, and I've always walked with crutches, and that's the primary way I get around. And I was able to walk with my crutches throughout my pregnancy. I did sometimes use a wheelchair if we went to the mall to buy baby clothes or something. And sometimes I used it around the house toward the end of my pregnancy just because it was more relaxing. But I was able to walk throughout my pregnancy, and I did not experience any changes in my mobility or my ability to walk after pregnancy. Every woman's different, but I did not experience any kind of changes like that. So people should be aware of that as well when they're thinking about.
That's your question.
Yeah.
Yes, I'm glad you brought that up. I do know one woman who did go from crutches to having to use a wheelchair after pregnancy. So I don't know how common that is, but it is something to think about.
It's a possibility, but it's not inevitable. Would that be a fair way to put it?
Yeah, yeah.
Good.
And I want to quick stop and answer one question. There's a woman who says she has a family history of spina bifida and her sister, and she was asking if she should take that 4 milligrams of folic acid 3 months before pregnancy, and the answer is yes. Any family member, like direct family member with a family history of spina bifida should take the 4 milligrams of folic acid.
And I
your
certainly,
OB may or may not understand that, but you can ask them to look it up.
and I certainly did that before, more than 3 months before pregnancy, actually. So
yeah.
All right.
Okay, so when you're pregnant, I touched on this before, but you should see all of your specialists. So you need to go see your OBGYN and review all of your medications. And just kind of talk about general planning. It's important that all of your providers work together and communicate with your OBGYN. So find one that you like and who will communicate with everyone. And then you're going to need to see your urologist so they can make sure you don't get UTIs, possibly put you on a low dose of antibiotic every day to prevent them. And then continue working on your bowel and bladder management. They'll probably also watch your kidneys and make sure they don't get swollen, the increased hydronephrosis or swelling retained urine in the kidneys throughout pregnancy. There's some degree of swelling of the kidneys or hydronephrosis that can occur in all women naturally, again, related to the baby sitting on our bladders and just the hormones that we release that kind of relax things. But they will make sure that it's no more than you'd expect. Then I would also see your neurologist or neurosurgeon, especially if you have a VP shunt in place or if you have a history of seizures, so they can help out with that. I love the physical medicine and rehab doctors. They are definitely helpful in life, but they will be helpful during pregnancy as well. So, the fit of your braces or wheelchairs may change as your whole body changes during pregnancy, so they can watch that, make sure there's nothing rubbing wrong or anything like that. And then some women talk, about needing like compression hose. I certainly had to wear them during pregnancy, but they can help get you fit for those, and they can be very helpful. Other specialists, any specialist that you see. So if you see a pulmonologist, some women have issues with their lungs. So if you see a pulmonologist regularly, you should see that. Any other specialist that you see, if you see a heart doctor or a kidney doctor, like the nephrologist, anything like that, I would see them. And then it would be wise to see an anesthesiologist before the day that you actually go in to have your baby. So we'll speak to that next, or soon. We'll come back to that. And then when you're pregnant, it's always good to take care of yourself. So things to take care of yourself, although we're not always great at doing so, is to take care of your mental and emotional health. So make sure to find time to relax, keep your stress low, continue doing things that you enjoy doing. Make sure you see friends and spend time with your partner, that kind of thing. Also important to get plenty of sleep. And so, sometimes sleep can become more difficult during pregnancy, and positioning during sleep can become more difficult during pregnancy. Some pillows help, pregnancy pillows, that kind of thing, but I would talk to your doctor if you're having issues there. And then in general, eat a balanced diet. There's nutrition guidelines for all pregnant women that you should follow, things like avoiding raw fish and avoiding alcohol and those kinds of, anything that applies to, women in general apply to you. One thing is to drink plenty of water. That will help decrease your risk of urine infection. So make sure to increase your intake of water. And then I would also recommend scheduling an appointment with an anesthesiologist well in advance to the day you deliver, so you can have a plan for pain management during delivery. So most women probably will not have an epidural, but there are some places who may feel comfortable doing it in certain women, especially if you've had like a spinal MRI and have a low level lesion. That will vary greatly based on where you are and also your level of lesion and if you've had an MRI before. So, but it would be good to go and talk to them beforehand and develop a plan. I think Linda has some
Yes,
input.
yes, I definitely would suggest that. I did not see an anesthesiologist until about a week before, and it actually wasn't the anesthesiologist I was scheduled to see. That guy canceled on me, and they dragged this other fellow off the floor, literally off the surgical floor, to talk to me. And that really wasn't enough planning. I think there should have been a more thoughtful plan about how anesthesia would be delivered to me during the labor process.
Yeah, and I've heard from other women that of all the people who were caring for them, the anesthesiologist really didn't understand spina bifida the most, especially if you have like maybe an anesthesia resident come in initially. I've heard some women talk about how the anesthesia resident would come in and give them a really hard time for not wanting an epidural, not understanding what spina bifida is or the anatomy with it. So I do think trying to come up with a plan in advance, you know, even if you go to the appointment and they have no idea what you're doing there, what spina bifida is, at least it gives them time to look something up and come up with a plan.
So on that, about, you know, when you speak to your anesthesiologist and, you know, hopefully with enough time in advance, what are some things that you think should be asked or told to the anesthesiologist?
I would just ask them how, like, their recommendations for managing your pain, given your spina bifida, and they can, as I said, some select places and very specific situations may consider an epidural, but I would ask them what, you know, they can do some local blocks, but that they should just have an idea of what they would recommend, because they're going to have to think out. They're so used to just coming in and doing an epidural, and pretty much every woman who comes in, and so they're going to have to think outside the box. And so just getting them thinking about that in advance, and also having a note from an anesthesiologist in your chart. So whoever is there on the day that you deliver, who's used to just going into every room, giving every woman a epidural, will realize, oh, maybe I can't in this case, and there's something else I should do.
Right. And I would add that I would ask them to take a look at any previous MRIs you have, as Dr. Storer was suggesting, and if it's possible to do an MRI before the baby's born. If that's possible, maybe have them do one just to see what inside of your spine looks like, just so that they can decide whether it's possible to do an epidural or not, or how challenging it might be. Would you agree with that, Dr. Storer?
Yes. And someone also asked, if you know your level of lesion, that will be helpful as well in talking to the anesthesiologist, because it's really only the very low level lesions where people are trying epidurals. So that can be helpful. Let's see, and I can't tell you exactly at what level they would consider it. It's kind of a new area. MRIs are safe during pregnancy. You don't want to do them in the first trimester, but they do not or involve radiation. A CT scan or CAT scan is not safe in general, or it does cause radiation, so there's only a certain amount you can have, but an MRI does not. But yes, I am not an anesthesiologist, so that is why I would recommend going to one so they can start thinking before you deliver. All right. So speaking of planning before you deliver that baby, I would recommend developing a plan for delivery with your OBGYN. So talk to them about your desires for the delivery, and they will talk to you about kind of realistic expectations as well. And they should document the plan in writing in your chart. And then in theory, like all OBGYNs who are in that same practice should be familiar with that plan, just because they can look in your chart. If you have an OBGYN who walks in who, when you're delivering, who does not seem to be familiar with the plan, I would say, you know, I talked about this with my OBGYN on such and such date. Do you mind looking at the note so they can be familiar? Do not be afraid to stand up for yourself. And in fact, do you stand up for yourself and what you would like, what your OBGYN said? You can, I should say, so there'll be a note on the chart, but it would be smart to also have it printed out in case you suddenly have to deliver somewhere different than you were expecting to. And then I would say, in addition, for you advocating for your plan, you really need whoever's going to be there with you on the day of delivery to also advocate for you. So whether that be your partner, your spouse, your coach, doula, whoever is there with you in the delivery room should also be advocating for you. And doing certain things like making sure they understand that there should be no latex in the room, and really they should be your warrior. You'll be going through a lot, and you want them to really be the warrior, and also the one who bugs them more. So they can like you, but and get annoyed with your partner, but that's okay. They should be the ones who are really fighting. All that said, there's all sorts of things that come up during the delivery that all women need to be flexible. So it may be that you want to try to do a vaginal delivery and the baby's not doing well, and so you have to get a C-section. That's just like any woman. So you do have to be flexible. Anything that you would like to add?
No, I think that all makes a lot of sense. I really do.
All right, so next slide. So this is, we've been seeing some questions on this, so hopefully this will answer them. So what should you expect? So we don't know as much as we'd like to know about pregnancy and delivery in women with spina bifida, but we do know that that you may be at increased risk of delivering before term. So be prepared. There may be some women who don't really sense the labor coming on, or it may be just kind of a weird feeling. So just be on the watching out for that. We do think that most women with spina bifida have very healthy deliveries. So what kind of delivery? Not all women need a C-section. The majority of women do undergo a C-section, but there's certainly no reason to have a C-section unless there's something with your anatomy that means that the baby couldn't get out, same with all women. Or the other exception is that if you have undergone a procedure to be continent, so a procedure on your bladder neck, that may be like a sling, or your bladder neck has been closed. Those women we think should have a C-section. The risk of doing a vaginal delivery would be incontinence afterwards. But other than that, most women can probably have a healthy vaginal delivery unless their pelvis is really small and the baby can't get out, or they've had that kind of surgery.
And I should note that I always thought I would need a C-section, and when I met with my OB the first time, she informed me that in fact I did not necessarily have to have a C-section, and I did ultimately deliver my son vaginally.
If you've just undergone, I'm getting some questions. So if you've undergone bladder reconstructive surgery, so like you have a bladder channel, or you have a MACE, or you have an augment where they put intestine into your bladder, but they did not touch your bladder neck, meaning they did not do a sling, or they did not close your bladder neck, then you can still have a vaginal delivery. If you're not sure about what you had, ask your urologist and they will help you. If you do have a C-section, your urologist should ideally be in the room during the C-section. And what we would do is make sure that your bladder stays safe, that they don't inadvertently injure like the bladder channel or the augmented bladder, anything like that during the C-section. Or if something does happen, we can repair it right then and there. Hopefully that answers your question. We're ready for the next slide. Maybe. All right.
Okay.
Yeah, sorry about that. We're getting lots of questions, and so I think we're all kind of monitoring to see if we're missing any. So if your question has not been answered, just send it again. All right,
Yeah,
go ahead.
there was a question that I'll answer at the end about men, but it's not directly related to this, but I'll get to that at the end.
Cool. Thank you.
So some women with spina bifida want to know if they're able to breastfeed the way other women do. And the answer to that question is yes. Women with spina bifida are just as able to breastfeed as any other woman. And depending on your level of mobility and balance, your trunk stability and that sort of thing, you may be able to do it exactly the same way as other women do, or you might need a little support. You might want to put pillows up around your back or the sides of you. And something that a lot of women do is they use pillows. They use an ordinary pillow or a breastfeeding pillow. You may have heard of something called a boppy, which is a pillow which is like a donut. It has a hole in the middle of it, and you just wrap it around you and put your baby on it and hold your baby that way. And the picture that you see in front of you is a picture of a woman using a boppy to breastfeed her baby. And lots of women use these, women with and without spina bifida. They're very, very common. And they have a variety of options these days of the type of boppy that you can use. So, and there are other companies, boppy is a brand name, but there are other companies as well that make these breastfeeding pillows. And they're very helpful. They're definitely very helpful. Do you want to add anything, Dr.
No, I use a boppy pillow.
Right. Yes. Lots of women do. So something else that I think is very important is figuring out how to get around with your baby or your toddler. And I think it's important to be realistic about your abilities and your limitations. So here are some suggestions. Consider changing your usual method of mobility. So for myself, for example, you saw that I was walking with crutches previously, and that is usually the way I get around. But when I was taking care of my baby, I always used a wheelchair. That's what I always did. And I had various methods of getting him around in the wheelchair, but that's what I did without exception. Also, you can use a modified crib or a co-sleeper. We'll show you a couple of examples of that in a moment. It's helpful to have a crib that opens from the side instead of from the top. And I'll explain that, and also a co-sleeper in just a moment. We bathed our baby when he was very little in a baby bathtub in the kitchen sink. I could sit in the wheelchair and easily put him into the baby bathtub in the kitchen sink. And it was high, so I could reach him easily. I didn't have to try to get him in and out of a low tub. And that worked very well. You might want to consider using a child harness to keep up with your toddler. It is amazing how fast little toddlers can be. I know with my son, even his preschool teacher remarked on how fast he was, and she told us to get him into track. I don't know why the universe decided to send my husband and I, who both had disabilities, an Olympic sprinter for a kid, but for some reason the universe did. So even though I know it doesn't look, even though it may be uncomfortable to consider using a baby harness, you might want to seriously consider it because the most important thing is really keeping your baby safe. That's an example there you see of a baby harness. There are other ones that are cuter that have a little baby backpack with a ladybug or a bunny or a little monkey or some other cute little character on it that looks a little less I don't know what the right word is, but it looks a little, looks cute, which is nicer with a baby than perhaps the example you see in front of you. But the most important thing is keeping your child safe. So consider it. Consider using a child harness to keep up, because as I said, they are unbelievably fast when they get to the age where they just want to go, go, go.
Do you mind if I add something to this?
Oh, please, please.
I've also had women say that, the child carriers that you can wear that are very popular for everyone are really helpful. I don't know if you use that, but there's all different kinds, and a lot of them are very easy to put baby in and out.
Yes. Yeah, we did absolutely use a baby carrier. We used what we used was called a baby Bjorn, but there are lots and lots of different types. I actually initially, when I brought him home from the hospital, tried to put him in a sling. For some reason, he didn't like that. He screamed bloody murder when I tried to put him in that. But he did like once he was able to hold up his head, we were able to use a baby Bjorn. And there are lots of different kinds of baby carriers, as I said, and that worked really well. So I would put him in the baby Bjorn and then wheel my wheelchair around the apartment. And that worked very nicely.
Yeah, and babies tend to really like it. It calms them to be so close to you. So they do have ones for infants that will prop up the head as well.
Yes, and they want to be close to you all the time, basically.
Yeah. Yep.
I think the current wisdom is that you can't hold your baby too much. And that's what they want. So here are a couple of examples of sleeping options. So on the left, you see a modified crib. It opens from the side instead of opening from the top, and that's very helpful. There aren't too many of these that are made on the market. You'll see when you get to the resources slide, there's one resource called Able Data, and I did see a modified version of a crib on Able Data, so you might want to look there. Another possibility is that there are enough moms with disabilities around now that people are willing to swap equipment. So you'll see also when we get to the resource slide, the Disabled Parents Project, and the Disabled Parents Project is an online community of parents with disabilities, and the moms on there are, there's a blog and there's different ways for parents to communicate, and people can swap equipment. So that's one way to get one of these. Or if you have someone who in your family who's handy and knows how to modify things, you can just have someone modify it for you. A lot of people do that. On the right is what's called a co-sleeper, which is what we use when our son was a baby. You can see me there. And I think I was standing up there, but my wheelchair is right behind me in that picture. And I'm just leaning into the co-sleeper and putting my baby down. So that works nicely for us. The co-sleeper is like a little bed that attaches to your bed. So the baby's right next to you at night. And that makes it much easier to breastfeed and do whatever you need to do with your baby, change diapers, etc. And it's very convenient, and it prevents you from having to get up and like me, get in your wheelchair and go to a crib, or it just limits the moving around and any challenges that might come with that. So so that's another option. Cool. Jory, do you want to add anything?
No, great.
Okay. So adjusting to parenthood. How does your relationship with your spouse or partner change? Well, one thing I would suggest is that it's a good idea to speak to your partner or your spouse beforehand, before you have the baby, about your expectations for baby care and sharing duties. I realized sort of in the middle of the first few days of parenting with my husband that we had very different understandings of how you deal with a baby who's crying because he doesn't want to sleep on his own. I kind of intuitively knew from having been around moms that one has to learn how to teach one's baby to sleep on his own or her own. My husband apparently was not aware of this fact. Which which led to a certain amount of conflict. So we ultimately worked around it, but I think it was a surprise to both of us about some of the assumptions we each had that we weren't really aware of, and how those assumptions might conflict. Anyway, so just try to talk ahead of time. Talk about the different tasks that you have, the different aspects of raising the baby, and your expectations for those. I want to say though, my husband was really, really wonderful for the most part. When our son was an infant, he participated in diapering and bathing and all those things. He participated in virtually all of the other tasks that you have when you're raising a baby, and he did so very willingly. We really shared the responsibilities.
Yeah, I mean, it definitely sounds like, it's an adjustment period for all involved, until you kind of get into the swing of it.
Yes, definitely.
No matter who you are.
Okay, so here was the part where we're going to ask you to send in questions, but you've already been sending us tons of questions. So that's a good thing. Thank you. Just forgive me if you already addressed this, but I know that there were a couple of questions about just wanting to get more information about MACE.
Yes.
In the MACE and pregnancy and, the relationship.
Sure. So certainly it'd be similar to the bladder channels. It may become increasingly difficult to catheterize a MACE during pregnancy. May or may not. The MACE has to travel less far to get out. Basically, your bowel is right next to your stomach. And so it may not be as difficult as the bladder, but you certainly could have issues. Most likely, if that were to happen, that we'd have you leave a catheter in. Very similar to some women with bladder channels. We just put a catheter in and kind of leave it there, exchange it every so often. The MACE, you don't have to worry about that as much. But but it shouldn't be a problem with pregnancy. It shouldn't be a problem with delivery either. But you definitely need to tell your OBGYN that you have one, because sometimes they can be quite discreet. Because it may, depending on where it comes out, it may determine where they will make an incision for a C-section, which they should, even if you're not planning on having a C-section, there's always emergent C-section, so they should just know about it.
Mm-hmm. Can you explain what a MACE is?
Yes, thank you. A MACE is, it's similar to a bladder channel, but it's a little channel that goes directly into the bowel. Most commonly, it's the appendix that we use. So we just basically bring the appendix up to the skin, and people can put a catheter in and do an enema through it. So use irrigation through it to have a bowel movement.
Okay.
Yeah.
Great. Okay, great. Now, there are a few more questions, and one of them is, if a woman with spina bifida is taking birth control pills for, and this I don't know, but PCOS. Yeah, go for it.
Okay.
So let's do the question for those that didn't see it. So do you want to read the question then, Courtney, or say what the question is?
I'm not sure I can scroll up, but I think the question was, there's a woman who is taking birth control for I think it's polycystic ovarian syndrome, and she was wondering if that would cause an increased risk of
or problems or complications for conceiving.
Correct.
Yeah.
So the birth control in and of itself should not cause any issues. Obviously, you have to stop it in order to become pregnant. But most women who get pregnant were on birth control, and we don't know of any issues that it causes during pregnancy. But obviously, again, you have to stop it to become pregnant. The polycystic ovarian syndrome I believe it's been a while out of my normal realm of expertise, but I believe it can cause some issues or difficulties conceiving. Not that you can't conceive, but it just may take longer. So I'm assuming in order to be on birth control and have the diagnosis of PCOS, you'd probably seen an OBGYN So I would just talk to your OBGYN about your interest in becoming pregnant, and they can guide you and probably give you a little better understanding of how it impacts your fertility, or how easily you can become pregnant. And you should be able to become pregnant. It just may take longer or be harder.
Okay, great. Thank you. All right, here's another question. Saying that she has met with her doctors before getting pregnant, and it never came up as an issue, but a doctor who knew nothing about her having spina bifida seemed very concerned when she said that she uses self-enemas for her bowel routine. So the question is, are self-enemas like gravity bags and Peristeen, in fact, safe?
Yes. Yeah. They, in fact, all women have constipation during pregnancy, and so doctors will often prescribe enemas to all women, but there's no reason that's not something that gets if you mix, say, Miralax, which is safe during pregnancy anyway, but if you mix different medications into your enema, it's not something that gets absorbed, and so there's no reason to think that should not be safe. I've not heard that before.
Okay.
But probably is just someone who's maybe not familiar with spina bifida, is my guess. In fact, I would say it's important to keep up with it because constipation increases your risk of urinary tract infections.
Okay, thank you. And here's one. Would an APV be one of the bladder surgeries that result in need for a C-section?
Can you tell me what an APV is?
Yes, please do tell us. And while you tell us what an APV is, we will jump to another quick question over here.
Maybe it's appendicovesicostomy. Yeah, if they can tell me what they're referring to, but it's only, if you just have a bladder channel, or you just have a bladder augment, and they did not touch your bladder neck, then you do not need a C-section. Again, if you are you're not sure if they did anything to your bladder neck, I would talk to your urologist, because they will know. But just like creating a bladder channel, or just doing an augment or a MACE or anything like that, should not indicate needing a C-section.
Okay. There were a couple questions about MRIs, and I know that you already addressed much of it, but in terms of would it hurt the baby, or if if they can have it done safely with contrast while pregnant, maybe just to reiterate that.
The contrast, there may be a little, that is a little controversial, I believe. Again, I'm not an OB, I'm a urologist, but an MRI is safe. We do MRIs in pregnancy quite often. So, based on your level of lesion, it may or may not be worth getting an MRI during pregnancy. Like your level of lesion could be too high that they wouldn't consider doing an epidural. But if it's one where your anesthesiologist would consider it, then an MRI is safe. There's no radiation. Radiation is what they're worried about during pregnancy. And radiation occurs with x-rays, it occurs with CT or CAT scans. And there's only a certain amount of radiation you should have. And so, but the MRI does not cause radiation.
Okay. Very good, thank you. So there's another question, which it was kind of we've been talking about COVID for like weeks now, but one of the questions, and this is actually, this is a good time, because I just want to make sure that that we are going to have, the Spina Bifida Association is going to have a webinar with an informational session, question and answers about spina bifida and COVID on Thursday, and I'll give you that information in a second. But the person's question was if about people with spina bifida being able to access medical care, and for the purposes of this webinar, specifically regarding pregnancy, OB concerns, et cetera, in terms of access to care for those needs at this time.
Should not. I mean, it does depend a little bit on where you are and how your pregnancy is going. But as far as I know, people are still getting routine prenatal care. Some of that may occur more and more by video. But as far as I know, there's no changes in getting normal routine obstetric care. But again, I'm not an OB-GYN. I know in urology, people who can wait were having wait or doing by video visit.
Okay. All right. And so I don't know if this is what APV is, but I looked it up. And could it be absent pulmonary valve syndrome?
No, I think they probably, my guess is it's appendicovesicostomy, which is it can actually mean different things, but usually a bladder channel.
All right. So, well, then the question is would the APB be one of the bladder surgeries that results in a need for a C-section?
No, nope. Just a bladder neck surgery.
Okay. And what about transitioning back to crutches after birth?
For me, that worked out fine. But again, every woman is different. It may be different for someone else, but I had no difficulty with it. I did not ever take care of my son, though, on my crutches. I always used a wheelchair.
Okay, so that was one of the next questions. Was it how long, did you spend in a wheelchair, or how hard was it physically?
It wasn't hard for me to use a wheelchair. I've used a wheelchair at different times in my life when I've had different problems with my feet, or I've had surgeries or that sort of thing. And so I really didn't experience it as difficult at all. It really was fine. I did have to get a new wheelchair, and I did that while I was pregnant. I did go and have a physical therapist evaluate me for a wheelchair, and they got me a wheelchair that worked fine. So that's what I did. So when I went to work, I walked, and when I was home with my baby, I used a wheelchair. Is how it worked. And I also, if we went anywhere, I used a wheelchair. And even as he got older, if we would go on vacation, I would use a wheelchair, because again, just trying to keep up with him. Even after the toddler stage, I mean, my husband uses a wheelchair, and my son is, like I said, a future Olympic sprinter. So it just made more sense for us as a family if we were on vacation somewhere for me to use a wheelchair, because I'm just not that fast. So I have used a wheelchair when we go on vacation, and for that sort of thing. Whenever it makes sense, whenever it's the most practical thing to do, that's what I do.
Okay. So question here, which I think is also important. All of them are really good. If the baby doesn't have spina bifida, can the mom with spina bifida deliver in a local hospital?
I would say that's up to you and your OB/GYN. Mm-hmm. I would see no reason not to, and I know women who have, sometimes unintentionally, but I would say that's up to you and your OB/GYN, partially because your OB/GYN will know kind of what other services are available should something come up more concerning with you. But certainly I know women certainly have delivered at a local hospital. Sometimes if a surprise comes, even if you did not intend to deliver at a local hospital, you may deliver at a local hospital, but I would discuss it with your OB/GYN.
Okay. And here's another quick question. Are laxatives safe rather than enemas?
That's another thing to talk to about your OB/GYN. I would say, so laxatives you ingest, and so some of them could be, it depends on what kind they are, but there may be some that you absorb in your bloodstream versus an enema, it goes in and then it comes back out. It does not get absorbed. And so enemas are very safe, but anything that you take, anything that you put in any direction, you should talk to your OB/GYN before doing it.
And Courtney, I know you have one last question for you. If you're self-cathing every 4 hours, would a Foley catheter need to be placed at any point during pregnancy? Would you expect that?
Yes. So if you are self-cathing, either through a bladder channel really, or through your urethra, the hole that you naturally pee out of, there is a possibility of needing like a Foley catheter. So that means a catheter that stays in your bladder permanently. I mean, you can you'll have it exchanged every few weeks, but would that be needed during pregnancy? Possibly. So everyone will be different. For some women who do self-cathing through their urethra or the normal tube that you were born with that you pee out of, it could be that it becomes difficult for you to reach, and therefore you may need to have a catheter that sits in your bladder continuously. And then again, if you have a bladder channel, it may be that channel becomes difficult to catheterize because the baby pushes on it, and then you'd need a catheter that sits in there continuously. It gets exchanged every few weeks. So I would say anyone would be at risk of needing a catheter in their bladder. I would say for those who are self-cathing, the most likely thing is that they will become incontinent, even if they weren't leaking before. But again, all bets are off. Anything can happen in pregnancy. So, but that's again why you will keep seeing your urologist regularly, so they can help walk through whatever is going on.
All right, well, thank you everybody for submitting so many questions. And if you have any others, please feel free to just send them our way. We'll give you information how you can do that. But let's keep going with with the presentation. We have just a few more things to show you. Oh yes, I'm gonna run a quick poll with everybody. And I've just submitted the poll. Basically, the question is, would you like a future webinar such as this to discuss adoption as a parenthood option? So while you're completing that poll, we will continue with the presentation. And now, Linda, would you like to tell us about all these awesome resources that you found for us?
Sure. Well, as I mentioned, there is the Disabled Parenting Project, which is actually affiliated with the organization below it, the National Research Center. And the Disabled Parenting Project is a great way to connect with other parents and also to connect with resources. They have a blog, they have a list of resources, they have a variety of really helpful information that you can take advantage of there. And they do webinars. We do webinars periodically on a whole variety of topics, early intervention and assistive technology. We have a really great webinar on there about assistive technology, which is actually one of the main speakers is a woman with cerebral palsy who also happens to be an occupational therapist. And it's a really helpful webinar for anybody with any disability to figure out how to adapt various things to help you with your parenting, adapt equipment and that sort of thing, adapt your house, etc. The National Research Center does research, but it also does provide a lot of resources like the Disabled Parenting Project. The Association for Successful Parenting is another organization that helps parents connect. Able Data is a listing of different kinds of assistive technology, equipment, things like that you can use for a variety of purposes, including I've seen some examples of parenting equipment there. Through the Looking Glass is another organization that provides information and support for parents with disabilities. It's located in California. And Rocking the Cradle is actually a report on how to ensure the rights of parents with disabilities and their families. There are times when some parents with disabilities have to be concerned about people questioning their ability to parent and talking about perhaps removing the child from them. And so Rocking the Cradle is a report about that issue, and it talks about people's legal rights. And so it's a helpful resource for folks if they have any concerns about that issue. So, and also I should mention the books. There are a variety of books out there. What to expect when you're expecting, what to expect in the first year. That one definitely saved us from a few trips to the doctor. There's also a Disabled Woman's Guide to Pregnancy and Birth. All of these are helpful, and there are lots of other helpful books and resources out there. So definitely do some Googling, explore the internet. There's a wide variety of resources And and the Spina Bifida Association has resources as well.
Thank you so much. And so, yeah, so this is, if you were curious, let's just jump into this webinar. I just want to make sure you're all aware of, and if you have questions about COVID and Spina Bifida, you will be able to, if you go to our website, to that page, it's actually also on the home page. If you go there, you'll be able to see it, about how to log in, how to register. It's at 2 p.m. on Thursday, this coming Thursday, 2 p.m. Eastern. And here you go. And so I just want to thank Courtney and Linda so much for agreeing to do this at this really, really tough time. You know, we know that you're both really, really busy. And in fact, Linda's going to just jump off and go care for some people. Courtney's going to jump off and go care for some people.
Thanks for having me.
No, thank you so much for everything. And we thank everybody who were able to join and send us questions. And if you have any questions, please send them our way. There's Judy and my email address. And in about a day or so, all these resources will also be up on our website. So thank you. Oh yes, go ahead, Linda.
I was going to say thank you to you and Judy and the Spina Bifida Association for hosting this webinar. It's really helpful, I think, for parents.
Oh, and you know what? And I thank you so much. Thank you so much. And actually, I made a mistake because, whoops, chaos. Okay, sorry about that. The webinar that we were talking about is actually the 26th. So I apologize for that mistake. It's the 26th. Thank you so much, Amy, for correcting this. So, all right. Well, thank you again, everybody, for joining. And we look forward to seeing you on the next webinar.
Thank you. Good night. Be
Good
safe,
night.
everybody.
Everybody. Yes, thank you.